introduce ourselves and a lot of the wonderful people that we work with up at St. David's South Austin Medical Center. And then we're going to take as many questions as we have time for. You can start whenever when questions occur to you, can put them in the chat box and we will try to get to all of them. I'll start by introducing myself. My name is Chris Cravey Hart. I'm an OB-GYN with Hill Country. I've been with the practice for 14 years. I'm an Austin native. I was born at St. David's, Maine. And I went to undergrad at Texas State University and then did my medical school training at UTMB in Galveston, and then went to OHSU in Portland, Oregon for my residency training, and then came back to Austin and joined Hill Country and have been here in South Austin ever since. I have two sons that go to local schools, and I enjoy hiking, and I'm an amateur fig grower and ukulele player, and love being part of Hill Country. I'll pass it to Maggie Landemeyer.
Hi, I'm Dr. Landemeyer. I'm one of the founding partners of Hill Country OB-GYN. I originally came to Austin in 1997. I grew up in Houston and went and did my undergraduate at Texas Tech University. Then I came back to Houston for medical school. I did my residency training at UTMB in Galveston, and then I was recruited to come to a practice in Austin in 1997. And things didn't really work out with that practice, so I started my own practice with some friends in 1999, and that's Hill Country OB-GYN. And so we've been here ever since. I am married. I have three sons. They're 25, 23, and 19. I'm about to be an empty nester, so that'll be a very interesting new phase of life. And I love delivering babies. In my free time, I run and swim. I sort of dabble with triathlons. And I'm actually doing some knitting. It's not turning out very well, but I'm trying. And I will now toss it to, I see Dr. Juno on, so I'll toss it to Dr. Juno.
Hi there. My name's Shannon Juno. I actually have a practice in LaGrange, Texas, and I am going to be sharing call with Hill Country. So I'm kind of a little different in terms of not being an actual practice member, but there's a reason for that. I'll kind of give you my story. I live in right outside of LaGrange, Texas, which is about an hour from South Austin. I live with my husband, and my two sons are both now college age, and we're actually about to be empty nesters too. We have an 18 and a 20-year-old. My husband is also a physician. He and I met in med school in Houston. I'm from this area, Central Texas, a small town, Texas, just down the road from LaGrange, where I was born in a small rural hospital. I went to UT Austin for undergrad, and then from there went to UT Health Science Center in Houston, where I met my husband, and we moved together up to Cincinnati and both did our residencies up there. Mine in OB-GYN and his in general surgery. And we practiced up there for a couple of years and had our children during residency, and then we missed home and we missed family. So we actually moved back to LaGrange at the urging of my dad because they had opened up a brand new hospital called St. Mark's Medical Center and had a brand new labor and delivery unit, and seemed to be a perfect fit. I practiced and am still practicing in LaGrange, but delivered babies in LaGrange for over 10 years until, unfortunately, being a rural community and a rural hospital and the struggles financially those small hospitals have, they had to close down the labor and delivery unit. And I was not quite ready to stop delivering babies. So I looked for alternatives, and Austin seemed to be the most convenient for patients in this area. And I actually have been delivering at North Austin Medical Center for the past several years. The labor and delivery unit in LaGrange closed in 2017. North Austin Medical Center is a great St. David's facility, but it is a little far from my patients in particular. And it's a very, very busy, kind of a little bit overtaxed hospital, I feel. So I reached out to Hill Country to see if they could use someone to help them out with their deliveries and help me out with mine. And I'll be starting to take call with them starting the end of August. So I practice, like I said, in LaGrange, but we'll be delivering all babies, bringing my patients to South Austin and then taking care of Hill Country patients while I'm there on call. And in my free time, I like to read and spin, hike, bike, to, spend time with my family. And that's kind of me in a nutshell.
Thank you. We're so glad to have you.
Thanks.
Dr. Quinn?
Hi, I'm Dr. Quinn. I am originally from the Austin Dripping Springs area, grew up out there, went to UT for my undergrad and then did medical school in San Antonio and then moved up to Missouri to do residency in Kansas City. I met my husband in Kansas City and we lived up there for the rest of my residency and then decided to move down to warmer weather. So we came back home to Texas where we've been here, and I joined Hill Country when we moved here. So this will be 5 years now that I've been with Hill Country this September. I have 2 little kiddos. I have a daughter who's 3.5 and a son who's 1.5, both delivered by Dr. Landemeyer, and then another one on the way. So I have no free time because I just take care of babies and busy with that, but I love it. And I love the area and very happy to be with Hill Country.
All right, thank you. We have 2 other doctors who work with us, and one is Dr. Lisa Schneider. I'm not sure she was on her way. Oh, here she is.
Hear me? I'm on audio. I'm gonna make it short and sweet because I'm driving up to the hospital to deliver a baby. But let's see, what about me? I grew up in a small town south of here and got out of there pretty quickly and did my undergrad at what used to be Southwest Texas, and then went to med school and did my residency at the UT Health Science Center in San Antonio. I went up to practice in Dallas for about a year, wanted to get that closer to home, and I guess I've been in Austin now in the Hill Country for about 17 years. What else? I have a daughter, Jillian, who's 9, and I actually have a lot of free time right now because she's off at summer camp. So otherwise, let's see what else we like to do. Pretty much just kid stuff. So I'm gonna let you go because I'm going on the little overhead thing here and getting into some traffic. So I'm gonna let you guys go. Okay.
All right, thank you. And then we also have Dr. Amanda DeCero, who I'm not sure is on the call, but plans to try to log in if she can. I know she's got a sick kiddo this evening, so we'll see if she pops in. We'll make some introductions there as well. I'd like to introduce Laura Evans. Laura, if you're on the call, have you introduced yourself?
Hi, everybody. My name's Laura Evans, and I'm the Director of Women's Services here at South Austin Medical Center. My job and my responsibility is to make sure you all have an amazing time when you're here. I am in charge of the nursing staff for both labor and delivery and postpartum and NICU. And so I have all the confidence that our nurses are going to take amazing care of you. We have a lot of very experienced people. We love working with Hill Country, and this is a great hospital. So I am here to answer any of your questions that you might have about your hospital experience. So put them in the chat or speak up, and look forward to having you all here at the hospital.
Thank you so much. Donna, I would love for you to introduce yourself and tell us a little bit about the lactation program.
Hi, I am, sorry.
Here you are. Oh, you're muted.
Sorry about that. Hi, I'm Donna. Welcome to all of you. I'm one of the lactation consultants at St. David's. I've actually worked with the Hill Country doctors for I don't know how many years now, since you kind of opened the hospital with me at the other hospital that I worked at. We have an amazing lactation staff, but we also have an amazing nursing staff that is very good with helping you with breastfeeding and those kinds of things. To kind of let you know how it works, we have lactation consultants on every day of the week. We do try to see everybody. That doesn't always happen if we're super, super busy. But if you have a particular issue or even just a concern, the nurses can put you on our referral list and we make sure that you get seen. And it's okay for you to say, I just want to see them because I'm a first-time mom and I need some help and I'm just nervous about breastfeeding. Just remember, breastfeeding is a learned behavior. It's a natural behavior, but it's definitely learned. And it's like you and your baby are dance partners, and we kind of help you get together and have a nice dance and have a good breastfeeding experience. I'll be posting some information in the chat box as far as things that we have a support group and things for you to bring and some information there. Please let us know, just post, if you post questions, I'll make sure I answer them, and I'll also be giving you my contact information so you can reach out to me prior to coming to the hospital if you have questions.
Thank you, Donna. Thank you so much. I like that dance partner analogy. That's a good one. I like that.
Yeah, that's a new one for me. You know, I have to change it up.
Susan, I see that you're on the call. Would you like to introduce yourself and tell us a little bit about the parent education program?
I would love to. Good evening, everybody. It's great to be here. I've worked with probably almost everybody on the screen for much of the last 20 years in various ways, but definitely the Hill Country team, which is awesome. Y'all chose very well. And that the lactation consultants are amazing. And Miss Laura Evans, I worked with for many years. So you are in super good hands all the way around. We offer classes once a month, 3 different classes. They are actually still on Zoom. I'm amazed, but inspired by all of my clients because they have made this work. They've definitely made it lemonade, and we have a lot of good interaction despite the medium. And so we didn't stop classes, not even 1 month when COVID hit. We've been going ever since. So if you go on our website, which I'll also post on the chat some information so you can see all the details of the content of each of the classes, but roughly the classes are, one is a childbirth preparation class. It's 6 hours. We do it on a Saturday. We take a little short lunch. It's a lot of dense material, but we really want you guys to be well prepared in the sense of expectations and, balancing best practices and current medical practices with clinical experience. I've been a nurse, perinatal nurse for 20-something years, and I've retired from nursing after 40 years. So I still teach and love that, and love helping young couples get ready for really one of the most exciting adventures they'll ever have. I have a set of twins that are now 30. I'm trying to get a grandbaby out of somebody, but they're all too busy, so I have to substitute. And then we teach 2 other shorter classes, newborn care, everything about the newborn and how you can be most prepared to bring home that little person that after they hand you that special little gift in the hospital, you go, oh my gosh, they're giving this to me to go home. Yes, they are. And you're going to do great. So we give you a lot of information, prepare for how to eating, sleeping, diapering, cord care, the whole works. And also too, how can you guys thrive, not just survive having a newborn, which means sleep and taking care of each other. And then our last course is breastfeeding success, getting you really recognizing that truly it is a learned behavior. So let's start practicing now. Let's get through a lot of material that can help me take a lot of mystery out of it. And we can talk really frank about what you may have heard from your siblings, friends, neighbors, the good, bad, the difference. so answer a lot of those questions. So it's a good interactive class, each one of them. I'll put all my information on the chat in just a few minutes, but please feel free to ask me any questions during this session tonight, and I'll put all of my contact information.
Thank you, Susan.
And congratulations.
Kristen, I'm going to come to your question in just a minute. I'm going to introduce one more person, Paris from Texas Family Connects. I would love for you to introduce yourself and tell us a little bit about your program.
Yes, of course. So like I mentioned, my name is Paris. I'm with Family Connects. We provide postpartum support. I've been with Family Connects for about coming on my second year. On the side, I'm also a postpartum doula. I have 3 kids, a kindergartner, a pre-K, and a 2-year-old. So busy, busy, busy all around. But that's a little bit about me. As I'm sharing my screen to kind of talk to you guys a little bit more about Family Connects, I just wanted to say thank you to South Austin Medical Center and Hill Country OB for allowing us to come and share a little bit more about the way Family Connects supports the birthing population at St. David South. So thank you for letting us be here. All right, so Family Connects, we have been with St. David South supporting the birthing population there since 2018. And we aim to care for all the newborn population there. And I'd like to give a little bit more information as we go. So let me just, can you guys see? I wonder if I can hide this out of the way. Have that out of the way. There we go. So every family has unique needs that are unique to every person. You might be a new first-time parent, 2 or 3 children, but we know with every new baby brings new things to, accomplish and to go through. And we want to support that in an individual way that meets your needs best. So some of the things that might be going that the nurse might go over with you in your visit could be how mom is doing, maybe connecting mom with some support groups in the area, also checking in on how mom is feeling emotionally. These visits happen about 3 weeks out, so it's a really good time to kind of check in with the family, check in with mom, or all kinds of different tips like sleeping tips, soothing baby, helping going back to work, all those kind of things. We know that first month of baby's life is really foundational for their development. So we aim to be there to take care of that and offer any support so baby can have the best possible, most healthy start. So the way that these visits work, I mentioned they happened about the 3-week mark. During the pandemic, we did switch to being virtual only. So those visits were happening over the phone, but now we are actually offering in-home visits again, which is so exciting. I'm so glad. So those will be taking place in August. So now whenever I speak with you or Sada speaks with you about your Family Connects visit, you'll have the option, if you prefer to have that visit be over the phone or in your home, whatever fits your needs best. And so the way that nurse will contact you, so we know we'll schedule with you when you're at the hospital. We are also actually back in your rooms talking with you. So that's a kind of a nice way for us to chat and connect and see what time frame works best for you. Once we have that appointment scheduled, about a week from that, the nurse will check in with you. The nurse is assigned to call you and check in with you. We want to make sure that in that time frame, since me and you had last spoke, that nothing is going on too crazy, that we can help you out if you need anything immediately. Make sure that time frame still works for you. And sorry, on this slide is not updated. It says telehealth visit, but like I said, you'll have the option. So that visit will be again at the 2 to 3 weeks mark. And then from there, we'll be able to follow up with you. So like I said, we try to connect you with whatever resources that you might need. If the nurse on your end isn't able to meet those needs or isn't discussing what you might need, we're able to connect you with lots of different support systems in the Austin area to make sure that you're getting that family-centered and personalized approach to your postpartum care. So eligibility, that's a really big thing. So first criteria is delivering at St. David South, obviously. And after that, it's on a county basis. So Austin city limits, Travis County, or Bastrop. And that can be a little bit tricky sometimes, but don't worry about it. We try to see as many people as possible. So if I have to come and to speak with you in your room and kind of say, hey, what county do you live in? Don't worry about it. We can chat about that then. But that is our general eligibility criteria. We do find those that live in surrounding areas. We try to connect with them regardless, and offer some, we have a list of email supports that might be in, like, for example, we have Hayes County that we can email to you, just so that way everyone feels like once they're discharged, they can go home with a little bit more additional support from Family Connects. So signing up for Family Connects, you'll talk to your nurse. They'll usually get with you in labor and delivery, have you sign a consent form. If not, it'll happen in postpartum. And then I will come and speak to you in postpartum if you have agreed to speak with me. You can also request a visit online. The link is there and I can put it in the chat as well. So it's a little bit easier to copy and paste. That way you can just get it taken care of and it's already done. We want to be, one less thing on what you have to worry about. That way you can just focus on bonding with baby. So if you take care of that prenatally or already now, then that's totally fine too. Also, we have our number here. That way, if you have any questions, you can text us, you can call us, and we can get back to you. If maybe you have any questions or referring, you can also use that fax number there. Yeah. And if you have any questions, like I said, again, my name is Paris Sara Acevedo. She is another program support specialist with Family Connect. So you'll either see me or her in the hospital room. And those are our contact information. So if you have any questions, please feel free to email me, text me. We also have, we're doing things on Facebook Live, which to support you in the postpartum. We will be a Facebook Live the 22nd talking about caring for yourself in postpartum as well. So I can put that information in the chat. But that is me. I'll stop sharing and kind of pass it back over so they can answer you guys' questions.
Paris, thank you.
Yeah.
Marissa was asking about Dripping Springs. Any plan for Texas Family Connects to cover Dripping Springs?
Dripping Springs is tricky. There's some addresses in Dripping Springs that are Travis County, and so that's the main thing. But yes, there are plans to be expanding to different hospitals or counties, but just hasn't happened at the moment yet. But we're looking at it soon in the future. We want to be the kind of the standard for making sure we're supporting everybody. But right now it is just Travis County, but it's coming.
Thank you. I want to go back to Kristen's. I want to go back to Kristen's question about the COVID precautions right now at the hospital. And I'm going to punt this to Laura because things are always changing and getting updated. And so I want to make sure we have the most current recommendations in terms of COVID screening, visitation. What's the situation right at the minute?
All right. So yeah, things have changed a little bit in the last few months. We are continuing to test every patient that's admitted to labor and delivery for COVID. We no longer do a drive-through test for our scheduled procedures, but you'll just be tested on admission. If you come to labor and delivery and you're just being ruled out for labor, for example, or doing something outpatient, you won't be tested, but it's for the inpatients. Our visitation policy has changed just a teeny bit. We are allowing one more visitor than we were prior. So you can have your main support person, and then you can have one other person in labor and delivery. That other person could be a sibling. So that's true once you get over to the postpartum area. So 2 visitors total rather than one. One can be a sibling once you've delivered and you're in the postpartum area.
And that not include your doula, right? If you had a doula, that's another separate person.
Correct. Your doula will be part of our team. So we do not count that as a visitor as long as they're truly a doula and, have gone through a little bit of doula training. So that's really it as far as the changes that we've seen, but we still are asking people to mask. We still are masking ourselves, and we still have COVID testing for all of our admissions.
Laura, when you say sibling, do you mean like children are able to come now, or?
Yes. So it's a little tricky because, again, you can only have 2 visitors total. So, I can see that being tricky if you have more than one kiddo at home wanting to come see the baby, but a child can be that second visitor if you are in postpartum already, and if that child is a sibling. And they are also asymptomatic. They're not symptomatic for any kind of like flu-like sickness. Everybody needs to be well when they come here in the hospital. And also, you are able to trade out your visitors. So there can be 2 at a time in the room, but you are allowed to trade out visitors if you like.
That's new.
Yeah.
There's a waiting area on the 2nd floor that somebody could wait in the waiting area, and that's how you can trade out.
Yeah.
So it's a little bit more than sitting in your car.
Yeah, it's better. That's way better. We do still ask people to be masked when they're in the waiting area because we don't know people's vaccination status. Of course, we're not testing or asking for people for their vaccination status. And that's part of the reason that we do want everybody to be masked for everybody's safety here. And also, you know, kiddos aren't getting the vaccine. So.
And Anna's question about, you know, your overnight visitors, they're not subject to the visitation hours. Like dads can come and go basically anytime. But if you're having other people rotating in and out, the visitation hours are over at 9. Is that right?
That's correct.
All right. And I know that's been a evolving thing. Obviously, you know, we're sort of playing it by ear and trying to follow the guidelines that have been laid out for us by the CDC and trying to be as safe as possible. But it is encouraged as much as possible for our patients and their visitors to be vaccinated. I think that's the best protection, of course. Marissa also had a question about C-section stay. Melissa, do you want to take that one?
Did you say my name?
Yeah, I know.
I was reading the question.
Dr.
Okay.
Can you talk to Marissa about this schedule?
So for scheduled C-section, so for any C-section, whether you're scheduled or not, the typical stay anywhere from 2 to 4 nights. I would say on average, most people are staying 2 to 3 nights. It kind of depends on baby. Lots of times they happen to do blood work on the baby to check for jaundice. And that's the same for vaginal deliveries too. The babies kind of, we're waiting for the blood work for that. And that usually happens around 36 hours. And so for C-sections, it tends to fall around the 2, maybe 3 days. A lot of times, like first time moms, our first C-sections will stay for 3 nights. Sometimes when it's a repeat, they're kind of like, yeah, we got this. And they want to go home after that second night. And if there's any like issues or pain complications or something, then they might stay a 4th night. For vaginal deliveries, kind of the same lines. Usually they're staying about 2 nights, but possibly going home the next day, depending upon where that 36-hour window falls for baby. So yeah, that's pretty much it. So I usually say 2 for vaginal, 3 for C-section.
I think it's a good rule of thumb. Kristen is asking, Laura, can you speak to the percentage of nurses on labor and delivery who are vaccinated? Is that, you know, information that can be shared? You know, I don't know if it is, but I could let you speak to that.
Yeah, and I just wrote this in the chat. I'm happy to say that the L&D staff is 100% vaccinated. We also will be wearing stickers on our badge if we've been vaccinated. And so you'll know if a nurse has been vaccinated. For all of women's services, it's near 100%. I can't think right now. I can think of maybe one exception due to the medical issue, but nearing 100% of our staff have been vaccinated.
Good.
Yay.
Yay. That's good. Anybody have questions about their pain management options? I had a question if how we were doing on nitrous oxide, if that.
Yeah, and I saw another question as Susan asked that. So we are very close, if not ready, for nitrous oxide. So if you came in today, we could get it together. The only thing we're doing right now is we have a lot of nurses who may not have been here when we rolled it out, and so we're kind of doing a re-rollout. But we have everything we need. We have lots of people who can do it. So if you want nitrous tonight, I can get it done for you. It may be a little bit of fumbling. We'll get it super smooth very quickly.
That's good.
Yeah.
Dr. Landmeyer, do you want to kind of talk about that range of pain management options that now can include nitrous?
Yay for nitrous. And so, we have lots of options for pain management during labor. And of course, a lot of people might choose not to have anything pain management wise for labor, and that's great. If that's your decision, we will support you, and we'll make sure that, you know, that's supported in that decision. In other, options would be nitrous, which is a gas that you breathe through a mask, and it's mixed with oxygen. It's laughing gas like you would get at the dentist's office. And this does help to take away some of the pain that you might experience during labor. Another option would be, the nice thing, I'll go back to nitrous for a second. The nice thing about nitrous is that it's really a fast acting, like it works really quick and you feel really better. And then when you stop breathing it, it is out of your system very quickly. The next option would be if you wanted maybe some pain medication in the IV. And the advantage of that is, of course, it feels good, takes off the edge of the pain, but the disadvantage is that it does cross the placenta and can affect the baby. So if we think that you're going to deliver in the next hour to 2 hours, we don't want to give you that pain medication through the IV because we don't want the baby to be under the influence of pain medication when he or she is born and kind of maybe suppressed in their breathing when they're born. And then the next option, and probably the most common option that you hear for pain medication management during labor, would be an epidural. And what that is a very, very small tube that's inserted into the epidural space that's around the spinal column. And into the epidural space, they inject anesthetic medications like lidocaine and pain medications. And so it only affects the spinal cord. It doesn't go to your brain, and it also doesn't cross the placenta, but it makes you completely numb generally from about the breasts all the way down through your feet. So you wouldn't be able to get out of bed and walk around once you have an epidural. And that's probably the most common pain medication management thing that we do for labor and delivery. And I've had, healthy, beautiful deliveries with an epidural, and I've had healthy, beautiful deliveries completely natural and everywhere in between. And so whatever you choose is the best option for you. We'll support you in that decision. If you know that you want an epidural when you come into labor and delivery, unfortunately, that does not happen the very second that you hit the door. It takes a little time to get things together. We need to do some blood work, and we need to start an IV in your arm to get things going. And so from when you say, I want an epidural, until you actually get pain relief from that epidural, it's about 30 to 45 minutes. And so if you already know when you're coming into labor and delivery, hey, I really know, I know myself, and I really know I'm going to want an epidural, let your nurse know, because she can kind of help navigate that for you before things get too out of control where you aren't able to sit still for the epidural, and or the baby's already coming and there's not time to get you the epidural before the baby's going to already be out, and we're going to say, you're just going to have to go for it, girlfriend. So that's probably all of the things I have to say about pain management during labor.
That's good. That was a good explanation. I like that. And I am glad that we get to add nitrous back, because I think that's like a nice stepping stone. You can say, hey, is this going to be enough? And sometimes it is. Sometimes all you need is just that little edge off. And of course, the epidural offers a more complete anesthetic, just a little bit different mobility. Let's see. What other questions have people got about St. David's? And what are the questions that we answer most frequently?
Commonly, people like to know where they go once they arrive at the hospital.
The labor, what to do when you think you're in labor. I can take that. I know the answer to this one. So I think the most important thing is, if you think that you are in labor, or you're not sure if you're in labor, or you think your water's broken, or you're not sure if your water's broken, the first thing we want you to do is call our office. So you're going to call, you can call the number that takes you to the Hill Country office. If the office is closed, it's going to give you the option to contact the after hours physician. And so you're going to want to take that option. You also have the option to call our answering service directly, and that number is on all of our cards in the office. And so you can stick one of those in your wallet when you are in the office next time, because that's, oh, there it is from Renee right there. And so you call, and the on-call doctor will call you back. Obviously, if it's during office hours, you'll talk to the triage nurse and we'll help you decide if it's time to go to the office or to the hospital. In the evening hours, when we're talking to the on-call doctor, we'll kind of help talk you through it. Sometimes we'll just chat with you on the phone for a little while so we can hear how you sound. We always know it's serious when it's the dad calling, and we know things are getting serious over there, and usually that's when we're going to direct you to go ahead and come on into the hospital. I always say I'd rather you have a false alarm and it's not really labor, it's a false alarm, rather than stay at home too long and kind of miss your window to kind of get the support that we offer at the hospital. So make sure you call, and then we will call ahead to the hospital. We'll let them know you're coming. They'll have all your chart ready and they'll be expecting you. So that's the advantage of letting us know. We are taking call 24 hours a day, but if we don't have a patient laboring, we may not be in the hospital. And so we love to hear from you if you're going in, so that we can be ready to be there for you too. So sometimes we're already there because there's already patients in labor, but it really does help us to know that you're coming so that we can be ready and let the hospital know too. And so I think that's the thing we want to emphasize most. When you get to the hospital, there's a triage unit on labor and deliveries, kind of a separate area where we kind of evaluate if the water's broken, evaluate if you are having cervical change with your contractions. And then if you are in labor or if your water's broken, you'll get moved to a labor room, and we'll kind of start that adventure. You'll, of course, you'll have a labor and delivery nurse, you'll get lab work done, and then we'll try to manage your labor as close to what you were planning as we possibly can. And so the take-home message is, please call if you think you're in labor, because we can help you sort it out.
One of the things for when you arrive to the hospital, if it's like during normal business hours, you can go in the north entrance and go straight up to labor and delivery on the second floor. But if it's after hours, you want to go back into the entrance that's next to the emergency room. And the parking situation at the hospital is a little bit tricky for maybe about 2 or 3 more weeks, where they're going to open up a brand new parking garage. But if you're going to deliver in the next 2 to 3 weeks, you may want to go to the back entrance by the emergency room, and they do have offered valet parking. So it's free valet parking. You don't even have to tip the guy or anything. You just let him park your car, and you don't even have to worry about where it is. He keeps your keys, no problem. So if it's after hours, be sure and go to the back by the emergency room. If it's during the day, you can come to the north entrance, but parking's pretty sketchy around that area. So you may just want to go into the entrance by the emergency room all the time.
Yeah.
And while we do like you to call if it's ever an emergency or you haven't heard from us, you don't have to have our permission to go to the hospital. I've had people ask me that, well, can I have your permission? No, you can just go. You're not sure if you're in labor, because again, we're the only one of us is working each night. And so sometimes we're in a delivery and we might be occupied for a little bit. So if you're ready to go, you think you're in labor, you've given it 20 minutes or something, you haven't heard back from us, and you're like, this is getting more intense, just go ahead and head on in. And then we'll try to call you back as soon as we can, but you don't have to have our permission to go to the hospital.
Yeah, I always tell people, I don't want you to sit at home and feel anxious. If you think that something's going on and you're concerned, you trust your judgment and you should come in. I think Donna's comment in the chat about having everything that you need to have a baby is there at the hospital. If you are at work or you're in the cotton traffic and you think you're in labor, you can show up at the hospital with nothing, and everything you need will be taken care of. Although it is kind of a good idea right around 36 weeks to kind of pack yourself a little overnight bag and stick it in the trunk of the car so that you're ready to go. So you have your own toiletries and your own nightgown, and Donna had also put some good breastfeeding supplies in there, and you can get that all ready to go. But don't feel like you have to have a huge bag to go to the hospital. They got toothbrushes, and they got gowns, and they got everything you need to last for a day or so. Marissa has a question about gentle C-section, placenta harvesting for encapsulation, and delayed cord clamping. Dr. Quinn, do you want to talk about those things?
So for the gentle C-section term, it's kind of a broad term. I'll just tell you what I guess my interpretation of that. Typically in a normal C-section, you have like a opaque drape that the mom and the partner kind of hidden behind while we're doing the C-section. And a gentle one, we have like, if you request, you can have a clear drape so that we can open it up so you can see the delivery and we can hold up baby and you can see baby and everything. Other aspects I've heard people incorporate with that is like music, and we certainly can play music during a C-section. If there's other specific requests, you might have to clarify what else you're referring to about a gentle C-section, but those are the main things I hear typically requested would be the cleared drape and the music playing. For placental harvesting for encapsulation, so that's typically something you're going to organize yourself with a company or a midwife or somebody or doula or somebody that's doing that themselves. It's not done like at the hospital, but you need to let us know ahead of time that you're planning to keep your placenta, and you typically need to bring like a cooler or something to be able to maintain that until you can get it off to get encapsulated. My one caveat on that, I would recommend that if you are GBS positive or if you wind up with an infection during your labor, like choreo infection, I would not encourage encapsulation because there have been associated incidents of infections of the baby postpartum for moms that have taken that. So that's just something to keep in mind. And GBS is, or group B strep is a bacteria that we'll check for when you hit 36 weeks. And so that does just put you at a little bit higher risk of issues with the baby. And then for delayed cord clamping, we do that pretty much universally for both vaginal and C-sections. Only instances maybe would be if baby's, very distressed and we need to get baby out and immediately hand baby off for resuscitation. We kind of milk the cord, so get some extra blood into the baby and then hand the baby off. So that would be the main time that we wouldn't do a delayed cord clamp. But the majority of the time, baby comes out screaming, crying, we do delayed cord clamping.
Yeah. And Donna added a note about skin to skin, and I would say that's our routine. Like that's not a special request. Everybody gets to hold their baby after the baby has a quick look by the neonatal staff. So everybody gets the opportunity as soon as and as often as possible for skin to skin. I think that's one of the real, things that I really appreciate about St. David's. I think they really have a very baby friendly, breastfeeding friendly, trying to incorporate the whole family in the delivery experience. I think they do an excellent job of that. Most of the things that people are sort of concerned about for a hospital birth, things like episiotomies and shaving and, those kinds of things, those aren't part of the routine experience of having a baby, anymore. I don't think. Certainly not at our facility. We, I really think, do strive not to do anything that's for our own convenience. We are trying to give you the birth that you want to have. If you want a vaginal delivery, we are going to do everything possible to try to make that happen. And we're going to try to do it safely. And that's our job, is to make sure that you are safe and that your baby is safe. And so if you do have a C-section that's unscheduled, you came in labor and had a C-section, I think you can feel very comfortable that we tried everything we could to avoid it if it was at all possible. And Donna's comment is very correct. I think we all still feel very fortunate to be part of the labor experience. I think we all recognize our role as a very lucky part of that piece, and we're always honored that we get to play a part in your birth experience. Are there other questions or comments from the other doctors or from anyone else on the call that want to make sure that their the part that they like to talk about is heard?
Some things that just came to me for the other C-section, we'll let dad trim the cord. So they can't cut the cord while we're doing the C-section because it's a sterile kind of environment, but we usually leave it long. So if dad wants to go over to the warmer where they're kind of checking on baby, dad can trim the cord. So you still get to have that experience too.
I know nobody really asked about circumcision, and certainly circumcision isn't, isn't applicable for every family. It's always optional for male babies, and no one will ever try to compel you either way. But they do offer that service at the hospital if you're planning to have your baby circumcised, but that is done by the pediatric service, unless you are a patient with the Austin Regional Clinic, in which case they will have you come to their office after you're discharged to do it there in their office. So that's good to think about in advance if you were planning to have your baby circumcised. Certainly not required. And they do offer the first series of the hepatitis B vaccine series at the hospital. Also, that's optional. You don't have to start it there, but it will be recommended at your pediatrician's office if you don't do it in the hospital. And that kind of touches on the pediatric team. All babies are seen by the pediatrician in the first day of life. So you will see a pediatrician every day you're in the hospital. Your baby will be evaluated by the pediatrician as well. Their outpatient pediatricians generally don't come to the hospital. Usually the hospital pediatrician will assess the baby and send a note to your outpatient pediatrician when you're discharged. And Renee, I think you can make that recording available. There you go. It's going to be on the website tomorrow. But of course, if you have any questions, we're happy to revisit while you've got us on the line. Well, it's always a pleasure. This is always one of my favorite things. I like, I think we like this format because it's a lot more convenient for everyone to get there, and you don't have to worry about childcare. But obviously, if you want to visit with us in the office, you're welcome to have visits with, some of the other doctors if you really want an in-person visit. And I appreciate all of you coming and all of you picking us and picking St. David's.
Also, just real quick, if you're interested in having a tour, we're still doing virtual tours, but it's a one-on-one tour. I put the number in the beginning of the chat. Just give us a call, and it will be a labor and delivery nurse who can show you around. We use iMobile, basically FaceTime. And if you have a different phone, we can figure out an app for you. But we kind of tour you around virtually, and then we can answer any questions personally for you and help you with any kind of pre-registration needs you might have. So just give us a call at Labor and Delivery, and we'll be happy to schedule that for you.
Thank you, Laura. I think if there's no other comments or questions, we will say good evening. And thank you everyone for coming, and we'll see you soon.
Bye. Thank you.
Bye.
Bye.